Hello everyone, we are group 15 and we are doing our English oral presentations. My name is Li Hongjie and there's my teammate Xu Chengfu. Okay, our goal is to help people with disabilities can have a normal life by using assistive devices. So our background is there's a 155 centimeters tall and weighs 60 kilograms and 50 years old Asian lady with a hemiplegia due to a stroke. And we want to choose some assistive device for her. So we start with what is assistive device by asking Gemini AI. So the answers he gave me is assistive devices or assistive technology is an item, pieces of equipment, software, or product systems that is designed, made, or adapted by maintain or improve the functional capabilities of a person with a disability or an elderly person. So the key characteristics are to assist a person in performing a practical task or activity for daily living. So here's are some examples of assistive devices, like a crutches, a manual wheelchair, and grab bars. Okay. The second question we asked him about what is the connection between assistive devices and physical therapy, and here's how he answers us. The connection between both assistive devices and physical therapy is critical and symbolic. And the first is assessment and prescription. A physical therapist's core expertise is biomechanics, movement analysis, and functional makes them essential for prescribe the correct device. The second is train and implement. The most goal is to prescribe a device is only the first step, and PT ensures that the patient knows how to use it and safely and efficiently in real life solutions. Then the third one is the rehabilitation and compensation. Assistive technology can play two major roles in physical therapy. The first major role is rehabilitation, as some devices are used temporarily to support the patient during the recovery phase, allowing injured tissues to heal. The goal is to win to the patient of the device. The second major growth is permanent compensation. Other devices are prescribed permanently to compensate for chronic or irreversible impairment, such as a custom wheelchair for a spinal cord injury. Here, the goal is to optimize the use of the device for a high quality of life. So mostly, the PT continuously evaluates the patient's progress, and as the patient's functional ability change, the therapist might adjust the setting of the device. This connected to our goal is to use AI to help PT, just like our course, to our major, so to help us choosing a assistive device to help people. So I asked him to tell me some steps of how to choosing an optional assistive device. The first step is define the user's needs and goals. So it's mostly aimed on what the users need and why he or she need these devices. So this is the most important step. You must clearly identify the functional gap the devices is meant to fill. The second step is assess the users and the environment, like who and where, like who would use these devices and where he or she can use. So the devices must match the user's physical and cognitive abilities, as well as places will be used. So the third one is explore and select options. The research phase. Based on the assessment, a team often including a physical or occupational therapist explores potential solutions ranging from low-tech to high-tech. The fourth step is trial the technology, the test drive. Before commit a phrase, the user should have hands-on experience with the leading options. Okay, so the last step is to implementation, training, and follow-up. Make it per minute. So once the best device is chosen, proper integrance is the key to success. Okay, so the fourth question, so we gave him how our patients like she is a 155 centimeter tall and weighs 60 kilogram and 50 years old Asian lady with a hemiplegia due to a stroke. So please, we asking for some assistive devices for her. So here are how Gemini AI gave us. So for mobility and emotional aids, its devices like Hemi Walker or one arm walker. This can help her in her life. That's how, because she is a little bit, not a little bit. She is hemiplegia, so he needs something to help her walk. And or if she's she's much more disabled, then we can use a wheelchair to help her. And self-feeding and the kitchen aids this can help. These devices can help her cutting food, scooping food, and food preparation. Okay. And stressing and hygiene aids, and it's just like activity for daily life, just like how she eat, like we mentioned before. So there's a bath safety assistive technology to help her, and a dressing device to help her dress up, because it's not really good functioning to dress, and grooming. Okay, here's our pros and cons, and it will be presented by Xu Chengfu.
Okay, let's talk about pros and cons. We have 3 points of advantage. The first is clear conceptual progression. The 4 pieces naturally form a learning sequence. The first prompt, what is an assistive device? The Gemini gives basic concepts and categories. And the second prompt, relationship with PT. Gemini gives professional role and clinical thinking. And the third prompt, steps for choosing a devices. Gemini gives the service and assessment process. And the last prompt, the realistic stroke case. Gemini gives the concrete application to a real client scenario. And this progression moves from definition, role in rehab, process, and case application, which is crystal clear. And the second advantage, a strong functional and user-centered orientation. Across all tasks, assistive devices are consistently linked to function, independence, and participation, not just equipment list. And the last advantage, realistic clinical content and example. The examples, such as cans, walkers, FOs, are clinically appropriate and recognizable to OTPT. However, they still have some disadvantage, such as insufficient explicit theoretical framing. The content implicitly reflects modern framework, but these are never named or briefly explained. And the second, limited interprofessional perspective. PT is rightly emphasized in second prompts, but OT, orthopedist, physician, or nurses are not clearly situated. However, this is a team-based decision-making, and role boundaries and collaboration are underdeveloped. And third, psychosocial, cultural, and long-term use issues are underplayed. And last, case application lacks prioritization and phasing. In the short case, many devices are recommended at once, but without clear priority levels and time phasing. Therefore, we give some wish list to improve generative AI. First, you need to give AI a series of specific background. Then, you need to tell him to integrate psychosocial and long-term use issues. Next, you need to tell it knows that it can refine the stroke case into a structured rehabilitation plan, not just some words. And this is our division of labor. That's all. Thank you.